Watching children laughing and playing in the backyard is something many parents take for granted. But for Anna Dittman's mom and dad, a scene like this was something they only dared to dream for their daughter Anna and her big sister Maddie. A dream that seemed unattainable the day their precious Anna was born.
I had the first view of what happened when Anna came out. It looked like she was missing skin on her ankles and wrists, and then as they were cleaning her off, skin was coming off as well.
They brought her in a covered isolette into my room, and the hospital chaplain, brought us a camera, very gently asked, would we like to have Anna baptized? And, then that it's very, very serious.
You could see in everybody's face in the room that this was not normal, and they had never seen that before.
Anna had been born with a rare genetic disorder called epidermolysis bullosa, or EB. The potentially fatal disorder causes the skin to blister and be extremely fragile. Skin so delicate, human touch is difficult.
I didn't get to hold her. We have pictures of Todd standing by her in the isolette, and then I was in bed. So I was able to see her. They brought her close to my bed.
The folks that transferred her over were kind enough to, bring her in and let her see her. And
I think they were just trying to do what they could for us in the event that Anna would not be with us.
I think they were doing the same research that I was doing, and the fact is, worst case scenario is the child would pass away fairly quickly, and so yeah, they were preparing us for the worst.
Anna was transported to Columbus Children's Hospital, where she spent her first days of life in the newborn intensive care unit. But her wounds were so severe, she was moved to the burn unit for life-sustaining treatment.
Essentially what was happening to Anna was that her skin was breaking down and her condition was worsening. She basically had blisters and lesions, much like a burn victim would have, but as a brand new baby. And that was covering about 90% of her body.
Children's burn nurse Sheila Giles remembers the challenges in caring for Anna.
Well, it's always an unknown thing at first because you don't know the intensity of the disease. It requires biopsies to really fully give a prognosis of what's going to happen with this child. And we had to heal with what we had right there. We had to work on her open skin, and that was pretty significant.
The EB disorder would attack Anna's skin on the inside as well. Getting Anna nourishment became a huge undertaking.
She had a lot of oral blistering lesions in her mouth, and that affected her ability to suck, to be able to feed.
The feeding tube in itself was a totally separate challenge, in that her skin, in a normal situation, the skin forms around the tube. When her skin, it kept breaking down and the hole kept getting bigger, and as we would pump food in, it would come out through the hole, and the acid in her stomach would make it worse.
With children with epidermolysis bullosa, because of the dramatic breakdown of their skin, the calorie intake can need to be doubled, quadrupled, to even help them to sustain their life, to be able to grow.
Also challenging for the Dittmans was the simple act of just holding their baby.
It was very unnerving to hold her. But they said still, it's still important to have that contact with your baby. And there was a lot of strategic picking her up and like putting her down, and that was really tricky, uncomfortable.
They used an egg crate, foam to lay her body on. As a mother, your first sense is to want to comfort, and the things that you want to do normally, to hold, to love, can cause your baby pain. It's very heartbreaking to see your child suffer.
Despite the severity of skin damage, Wendy and Todd stayed focused on one thing: the day they would take Anna home. To do that meant learning to change her dressings, a painful ordeal for parent and patient.
And essentially, we were in a burn dressing room with her for 3 hours at a time to do the whole process of taking down her bandages, treating her skin, washing away any of the skin that had atrophied, and it was very painful for Anna, very, very painful. Our little baby needed morphine to make it through just being able to do that procedure.
I saw right away that they were going to be able to. It was just helping them get to that point. I think, every family is unique and different, and I think that it all depends upon their strength, what they bring with them to the table, their outcomes, their outlook on life, what they can do. The Dittmans were wonderful because they were engaged right away, even though they were in pain.
Just 28 days after her birth, the Dittmans were ready to take Anna home, but the milestones would come slowly. Her type of the disorder was determined to be EB simplex, and what that means for Anna is that it was most severe at birth and gradually will improve as she gets older.
She wasn't 2 until she walked because the blisters were so bad on her feet. Her feet were by far the worst area, and the pain, and so she just developed that little personality.
Very outgoing, very take charge, very, she's a smart kid. I think which all of this will serve her well in her future, to have that extra confidence and to have the ability to deal with people if they stare or say something. But she's definitely an outgoing child, and she's a real winner.
Today, at 4 years old, Anna is rolling right along. She's keeping up with her big sister and looking forward to being a big sister herself. Her life is full of smiles and giggles and preschool. The Dittmans want to thank Children's Hospital for helping their dream for Anna come true.
Those are all the things that we had wished for and prayed for during those very, very difficult times, and to have that opportunity to see that is wonderful. And it's, we wouldn't trade anything for the world. She's our gift.
Okay.